I know you must have been hearing a lot about cervical cancer lately because the vaccine is out there and they are urging women to take the vaccine. And it's very important you do that. But before you do that, you need to understand everything about cervical cancer, from your risk factors to the causes and to the treatment. So if you want to learn that from this video, please stay tuned from the beginning to the end of this video to learn a lot. This is a full teaching video. If you don't listen, you won't get any information. What is this cervical cancer? Cervical cancer starts in the cells lining of the cervix. That is the lower part of your that is the mouth of the womb that connects to the vagina. Early detection through regular screening can help to improve your outcome of this condition. Then here are what you need to know about the signs and the risk factor of cervical cancer. Talking about the signs and symptoms of cervical cancer. Cervical cancer often has no symptoms at the early stages, but as it progresses, you might notice an unusual vaginal bleeding. If you are bleeding in between periods, bleeding after sexual intercourse, or bleeding after menopause, this is not normal. Then the next one is unusual vaginal discharge. If you are having watery, pink, or foul-smelling discharge, this is definitely a sign. Then another one is pelvic pain, pain in the lower abdomen or pelvis unrelated to your menstrual cycle can be a sign. Then pain during intercourse. If you are having discomfort or pain during sexual activities. Another one is changes in your menstrual cycle. You notice that it's becoming heavier or longer menstrual cycle. Then the next one is urinary problems. You have increased frequency or urgency to urinate, pain during urination, you need to be evaluated. Then there are some risk factors associated with cervical cancer. If you have this human papillomavirus, that is HPV virus, is a sexually transmitted infection and can lead to most cancers, including cervical cancer. The next one is smoking. Increases the risk of your cervical cancer, especially women with HPV and you are smoking. If you have a weakened immune system, like conditions like HIV or medication that suppress your immune system. Then the next one is chlamydia infection. This is a sexually transmitted infection that affects women, can increase your risk. Then if you are used to poor diet and being overweight, can increase your risk. If you are on long-term use of oral contraceptive, that is using birth control pills for more than 5 years or more. The next one is if you have multiple pregnancy, that is having 3 or more full-term pregnancies, is definitely a sign. Young age, you have a child before the age of 17. Then exposure to sexual contact before the age of 17. Then family history. If one of your sisters have had it in the past, you might be at risk. Saying in essence, if you're a woman and you are still in your childbearing age, you are still menstruating, this can be a heavy risk for cervical cancer, and you are sexually active too. It can be a risk factor. Then the next one I'm about to say is, how can you prevent it? You prevent this thing by going for this regular screening, pap smear. They have been talking about pap smear and HPV tests that can detect this cervical cancer early. Then another thing is HPV vaccination. Once you are negative, you have to collect the vaccine to provide protection for yourself. The next one is safe sex practices. Always use condom. Limit the number of sexual partners you have. Then the next one is quitting smoking. Reduces your risk of cervical cancer and other type of cancers. Then healthy lifestyle and maintain healthy diet and weight, which can help to boost your immune system. So as you have understood all the signs that are and symptoms that I've mentioned, and you don't want to come down with this type of cancer, please go and do your HPV test, take your HPV vaccine, and protect your life. See you in my next video.